COVID has come to stay. And for the health of this country and in the health sector, we must all play a role. The data available to us indicates that the vaccination rate in some of the regions are very, very, very low. And unfortunately, this is happening in the rural districts where we have very weak health infrastructure or health system. And so if we are not very careful as a country, and then these places are hit by another wave of COVID, it will be a disaster. It will be a disaster. And therefore, we are encouraging everybody who has not been vaccinated to do so immediately. It is very important. Whether there has been this conspiracy theory about side effects of the vaccines. Almost every member of the Parliamentary Select Committee on Health have vaccinated. And a lot of people in this country have also been vaccinated. And so most of the things people are saying about vaccination are not true. So we must all be on board to educate the people, sensitize the people to vaccinate.
The ranking member stated emphatically that the country is likely to witness a wave of outbreak of COVID-19.
Whether we like it or not, we witness another wave of COVID, as it has been happening in other countries. And so if you go to regions like, according to the data, regions like the Oti region, Volta region, Eastern region, the Western North region, Ashanti region, we have very, very low vaccination rates.
While calling on the Ministry of Health and the Ghana Health Service to ensure the availability of vaccines in the country's districts, he noted that negative side effects views about vaccines are not true.
At this point, I'm also encouraging the Ministry of Health to come on board because it's as though COVID is gone. And so we want to wait for another emergency before we start talking about it. And we are also encouraging the Ministry of Health and then the Ghana Health Service to make the vaccines available in our districts so that people can get access to the vaccines whilst we are encouraging people to go and take the vaccination.
Meanwhile, showing commitment, Chairman for the committee, Dr. Free Ayu, disclosed that starting tomorrow, July 21, 2022, the committee will embark on a district-to-district campaign to educate the masses on the need to get vaccinated.
Initiative, and we stand together as a committee to whip up patronage for the vaccination, talking about COVID. Just like Rankin said, giving us about 18 million has been vaccinated, and they have the capacity to vaccinate over 22 million. What happens is, in any strike of COVID, any wave, all those who have been vaccinated the third time, the fourth time, and those of us in the urban centers will be covered. Unfortunately, if there is a rage, it would engulf those in the rural areas who, through superstition and several other reasons, are not vaccinating. And these are the most vulnerable people in society. It's on this scale that we are announcing to you that starting tomorrow, the health committee is going to the various regions, and we are going to campaign for the citizens and for those who have not yet vaccinated to get their vaccines.
He further called on all and sundry and said,
We want to use the medium and also as partners, as a media in Parliament, that would want all of you to report this on your portals, on your TV networks, on your radio networks, so we see that as media people who are with us here and who are supposed to help us reach the public, on this occasion for this project, you side with us that the rural poor who are not vaccinating for some reasons must be reached for them to be vaccinated. So we are counting on all of you here to lead that report and charge the citizens. And we have analyzed the situation and we have seen the need to support the Ghana Health Service. So we need those also media men here that we want to count on you to make such fantastic reportage and to be spread all over on the airwaves, on the portals, for your support for us to reach out to the public on this.